Anxiety is something that's becoming more commonly discussed and felt amongst most individuals. As expressed in the DSM-5, anxiety and fear couple together and fall under most anxiety disorders. Fear itself is more of a here and now, fight or flight type response, where anxiety is more of a fear of the future. Those who experience anxiety tend to want to prepare for the worst. They want to run through what could happen and try to anticipate any future fear or discomforts. Those experiencing anxiety symptoms that are more acute are going to be heart racing, sweating, difficulty breathing. More chronic anxiety symptoms are going to be fatigue, sleep difficulties, or irritability. Most anxiety disorders are persistent beyond 6 months and are associated to a specific fear. Diagnosing any anxiety disorder has specific criteria to that diagnosis. I'm going to be talking about generalized anxiety disorder and social anxiety disorder. At first glance, general anxiety and social anxiety disorders appear to be similar because they have a sense of event or situation that they're associated with and have similar anxiety responses. Social anxiety would consist of at least one social situation in which an individual feels anxious or fearful, and they tend to have an irrational fear that others are judging them. This would include fears of how that individual will act and how others will perceive how that individual is acting, and scrutinize how they're speaking, what they're doing. In the video, social anxiety disorders, causes, symptoms, diagnosis, treatment, and pathology, there is a big emphasis on judgment from others on social anxiety. That is one thing that sets it apart from general anxiety, is that fear of judgment from others. These individuals often recognize that the level of anxiety that they're experiencing is not proportionate to that situation, but they can't really control how they're responding. A specific specifier for social anxiety would be performance only. Those who have performance only anxiety are going to be situations like they are going to be giving lectures, they're actors, they're dancers, something that is a specific performance that they get anxiety when they're going to have to perform that. Generalized anxiety disorders are excessive anxiety and fear on most days and occur more days than not for at least 6 months. This could range from finances to work to social interactions without that specific judgment that like social anxiety has. Worry is hard to control every day, and everyday worries tend to have a physical anxiety reaction, whether that be the heart racing, sweating, or difficulty breathing. They also have 3 symptoms that are required, and that is out of a set of restlessness, fatigue, concentration, irritability, muscle tension, and sleep disturbances. Again, only 3 of those diagnoses are required. And general anxiety disorder doesn't have a specifier or something specific to specify, other than maybe just the specific event or if situations that they are experiencing anxiety. Anxiety associated with general anxiety disorder is usually more intense, it lasts longer, and usually there's more situations involved than just one event. This could be finances, you're concerned about your children, work. There's usually multiple, and the more that individual presents with, the more situations they present with, the more likely they are to be diagnosed with generalized anxiety disorder.